Hi, this is Dr. Roost with Delta Chiropractic Center, and if you're watching this video, it's because you're a new patient here or you've gotten a new set of exercises. This video is about one of our 6 components to better health. We call it the reservoir of health, and it includes nutrition, rest, exercise, stress management, spiritual health, and your spine. Today we're going to talk briefly about exercise and particularly your maneuvers, the specifically prescribed exercises we gave you at your report of findings for stabilizing your spine, rebalancing muscles. Now within exercise, there are a number of components we should have. We should have cardio training, we should have resistance training, we should have balance retraining, we should have core stability, and your specific maneuvers for your spine. This is what we're going to cover today. I've done other videos on the other components and we can review those. But right now, your maneuvers, critical. The better you do these, the less you need me, the less you need us at Delta Chiropractic Center. So this is your homework. This is the most important thing you can do outside the office to proactively work on stabilizing your spine, your maneuvers. Typically we'll ask you to do them twice a day. They take you about 5 minutes to go through them. The key to these is you're going to do an assigned position. You're going to hold each position for 10 seconds, then you relax, and then you repeat it the number of times that's listed on your form. All right, so I'm going to go through the most common ones. I may miss a few that are a little out there and very specific for specific situations, but let me get the key ones done. And I'll demonstrate them briefly so we don't drag this video out any longer than we have to. So the first one is the door push. In the door push, you're going to find a doorway, and with the door open, stand with your hands at shoulder level. Pretend there's a door here in front of me. Hands at shoulder level on the door jamb, not in the door jamb, against it like this. And then you walk into the doorway so that it's pulling your shoulders back, and you'll hold that 10 seconds, then you relax. Make sure you're not leaning in, you're walking in upright like so. Then you relax. You'll repeat it the number of times. 3 times is typical, sometimes 5 times. Number 2 is the hitchhiker. Hitchhiker, you're going to stand with your arms out to the side with your thumbs up like you're hitchhiking on both sides. You're going to make small circles backward, not quick ones. You don't want momentum here. You're going to go backward far enough so that you feel your shoulder blades pulling together. It's not a shoulder exercise, it's a shoulder blade exercise. Circles like this. Again, 10 seconds is 1 repetition. Typically you'll do 3 or 5 repetitions. Number 3, the glide neck back. You used to call it the chicken, but for this one, you're going to move your head straight backward. Excuse me, you're not going to tip back, you're not going to tip down, you're going to move straight back. Some of us don't have any motion there, so it'll feel really weird. It helps if you put your finger on your chin just to glide back. You're not pushing back with your finger, you're just reminding yourself to glide straight back. Hold it 10 seconds. Again, this one can be irritating, so go gently with this. Don't muscle through it. Go gently and you'll feel it improve over time. Number 4 is the side tip. Very, very common for our patients. You simply tip your head to the side as far as you're comfortable. Don't push past that comfort point. You hold that 10 seconds. Typically you'll do more to one side than the other, but you hold each repetition 10 seconds. A common ratio is 3 to one side, 10 seconds each, 1 to the other side of 10 seconds. That's the side tip. Side bend is very similar. Oh, let me go back. With the side tip, a common problem is people want to twist, and we don't even know we're doing it. So have somebody watch you or do it in a mirror so you're not twisting. Side bend, this is the same thing except it's for the low back. You're going to bend straight to the side as far as you're comfortable. Hold it 10 seconds. Do it the same. It's again a ratio of right to left, sometimes 3 to 1, 4 to 1, 4 to 2. But each repetition is 10 seconds each. This has the same caution. The tendency is to bring your shoulder forward. Don't do that. Keep your shoulders equally back. It may help to do it against a wall. That way you can feel your shoulders staying back against the wall. That's the side bend. Next, let's come back to those 2. Let's do the bird dog. Bird dog is done on the floor or on your bed, and you just get on your hands and knees. You're going to bring one arm and the opposite leg up like this. Your head will look down at the hand that's still on the floor. You hold it 10 seconds. The caution is don't work hard at it. Don't hyperextend. You want a straight line from your fingertips to your toes, so you're like a tabletop the whole way across. Start gently with that. If you cannot get on your knees comfortably, you can do it standing. So ask the staff or one of the docs next time. If you can't do the bird dog on your hands and knees, we'll explain how to do it standing. It's a little complicated. Number 5, I think it is the glute bridge. This is a common one. And basically this is done laying on your back, and you're going to bend your knees like so. You're going to bring your hips up off the table. The goal is to have a straight line from your shoulders to your knees, and you hold that 10 seconds. There's an advanced level of that where you bring one leg up at a time and hold it to 10 seconds, and then the other leg up and hold it 10 seconds. That is the glute bridge, and it's a good one for the stabilizing the low back. Let's see, the leg abductor is done laying on your side, and you simply bring your top leg up and hold it 10 seconds. This one can also be done standing. If laying on your side and bringing it up is too hard or too painful, you can do it standing, where you just use something for balance and bring your leg straight out to the side. I prefer to do it laying on your side, laying down, but if you can't handle that, you start with baby steps by doing it standing. It's not quite as intense. All right, let's go back to a couple that are a little less common. The Sphinx is done laying on your stomach, and you will rest on your elbows and relax your hips down. So there's no work. You're not pushing down. You're just relaxing your hips down onto the surface you're on, the floor or a bed or a couch. If you can tolerate that pretty well, you go to the advanced level, which is arms straight and let your hips relax down. This is a big step forward, so don't do that until you're ready to do it comfortably. And if it hurts, like all of these, if they hurt, back off on them. Don't muscle through them if they hurt. Talk to your physician, your doctor, before you push through those. The other one that's a little more unusual is the opposite of that. It's called the pelvic roll or the hip roll. I recommend doing it against the wall with your feet out from the wall a few inches, maybe 4 inches, just whatever's comfortable. And then you roll your hips like this, pushing the small of your back against the wall. This one's a little bit tricky for a lot of people, so if you can't figure it out, let us know. We'll walk you through it. But basically, you are straightening your low back by rolling your hips backward. You hold that 10 seconds. The hip roll and the Sphinx are a little bit diagnostic too, so if they hurt, make sure you bring that to our attention so we can walk through what to do with that information. Let's see, those are the main ones that we give out pretty commonly. There are some others. The cat camel, I think Dr. Dale uses that one quite a bit. The cat camel, you're on your hands and knees again, and you just drop your back down and then bring your back up. So that's one that he uses quite a bit, and that's how I do that. The knuckler is the one for your feet. If you got arch issues, the knuckler is done by pushing down with your toes and then dragging your toes. I don't know how to demonstrate that on this video, but it's like you're digging a hole in the sand with your toes. You push down and repeat it. That's the only one you don't hold 10 seconds. You just repeat it over and over. You can do it with shoes on or shoes off. You can do it standing or sitting. Pretty easy to do. You just repeat it the number of times. Typically it's 10 or 15 times to work on the muscles that hold the arches together. All right, so that's the maneuvers. As you do them, stop if they hurt. Don't push past the point where they're uncomfortable. If there's any questions or issues, talk to us your next visit. We'll make sure you get the information right, and we'll work through it till you can manage them. We can usually custom build them to your situation, wherever you are in your physical health. All right, so Delta Chiropractic Center, doing your maneuvers. God bless. We'll see you down the trail.